Today we're going to be talking about psychedelic assisted therapy. This type of therapy uses microdosing of psychedelic drugs to help enhance the therapeutic effects. The drugs that are normally used are things like MDMA, LSD, ayahuasca, and some others that you can see here. This type of therapy is predominantly used for PTSD, post-traumatic stress disorder, depression, and addiction. There are some others that you can see here that it's used for, but it's mostly used for those main three. So this type of therapy uses microdosing drugs and usually occurs in 3 stages: the preparation stage, the acute psychedelic experience stage, and the integration stage. So normally clients will come in, they will have some therapy sessions, just regular therapy sessions with the clinician, and build that therapeutic relationship up. They will then come in for a psychedelic therapy session where they're microdosed with a type of psychedelic. Normally they have the patients lie down on a bed, they cover their eyes with one of those like sleeping masks, put some blankets on in case they get cold, and allow them to experience the psychedelic effects. There often is some talking involved during that stage, but most of the therapeutic effects occur after in the integration stage, when therapists and clients break down and sort of unpack what the person experienced during their psychedelic experience.
So I'm dreaming that I'm running and the monster's about to get me.
These drugs are really effective because they basically help to shut off a part of the brain called the default mode network. This is a network that sort of filters your thoughts, tells you probably shouldn't say that to someone, things like that. And the problem with this is that someone with PTSD or depression, that network can get stuck in repetitive, rigid modes. So psychedelic experiences help to break that person out of the rigid thought patterns they're experiencing and see things from a different perspective. It's important to note that psychedelic assisted therapy is not to be used for things like learning disabilities like dyslexia or ADHD or autism spectrum disorder, and it's also not to be used for intellectual disabilities. Next, we're going to be talking about 2 studies that show the efficacy of this type of treatment. The first study we're going to look at was conducted in Brazil and took 17 people with PTSD, brought them in and ran them through this process of psychedelic assisted therapy. At the end of 12 months, they found that 70% of the people who came in no longer met the criteria for PTSD, and these effects lasted up to 4 years after the therapy was administered. So that's a pretty good success rate. Some limitations of this study are that, of course, it was only 17 people. That's not a big, sample size. And also, the majority of the patients experienced adverse side effects like hypertension, so increased blood pressure, and tachycardia, which is increased resting heart rate.
I'm having another heart attack! Call 911!
Of course, these aren't major side effects, and they only occurred during when the psychedelics were administered because they are side effects of those drugs, but it's still important to note. Although overall, I would say that 70% success rate is a pretty good margin, and I would say that this test showed that psychedelic assisted therapy, specifically MDMA, is effective for treating PTSD. The second study we're going to look at takes place in California, where they took 26 people with PTSD who were military veterans, ex-firefighters, and ex-policemen, brought them into a lab, and did microdosing of, again, MDMA. This time, they divided the group into thirds, gave one group 30 milligrams of MDMA, one group 75, and one group 125 milligrams. At the end of the study, which was 3 months long, the groups who received the 70 milligrams and the 125 milligrams had significantly decreased symptoms of PTSD, which showed a pretty good rate because 2/3 were successful. Of course, the limitations of this study were, again, only 26 people, not super high. And also we can see here that MDMA is clearly the drug that is most used when studying, and also treating PTSD is the condition that is most used for test samples. So it's important to note that there isn't as much evidence for psychedelic assisted therapy helping with depression and helping with addiction. It just hasn't been studied as much. As well, again, the 26 people, out of the 26 people, 20 of them reported mild symptoms, again, like the hypertension, the tachycardia, because those are just the side effects that come with taking MDMA. 4 of those people reported significantly adverse side effects. However, at the end of the study, they found that 3 out of the 4 people had prior medical conditions that had caused those adverse effects. So it wasn't really the MDMA that was causing it. And overall, again, I would say that this study also shows the efficacy of psychedelic-assisted therapy. It's also important to note here that, as we can see from these 2 studies, people with prior health conditions probably aren't going to be the most adept to use these drugs because they do come with mild side effects. So for example, if you come in already with hypertension, a high blood pressure rate, administering MDMA is only going to increase that and could potentially put the heart at risk. Same with tachycardia. If you already suffer from tachycardia due to a pre-existing health condition, we can see that because it increases heart rate and causes tachycardia in just the average person without increased heart rate, that these types of treatment might not be as effective or might be actually detrimental to someone who comes in with pre-existing health conditions. So, when talking about psychedelic-assisted therapy, specifically in the Canadian context, the first clinic to open and utilize psychedelic-assisted therapy actually opened a week before the pandemic started in March.
Oh man, what are the odds of that happening?
And this clinic is called Field Trip. They use microdosing of ketamine, which is not a psychedelic drug, but it is as sort of an anesthetic drug. Ketamine in Canada is normally used for medicinal purposes, specifically for treating chronic pain. However, in this case, they are using ketamine to microdose for therapeutic effects. Because in Canada we have strict policies on psychedelic drugs, most of the drugs that are used for this treatment are actually illegal in Canada. Things like ayahuasca, MDMA, LSD, ecstasy, things like that. So they've had to use ketamine because there's just really no other choice. It's important to note also, and something that I think is pretty cool, is that in the 1950s, Canada was actually the leader in psychedelic-assisted therapy, specifically out of the university in Saskatchewan, where they were making major breakthroughs and doing really good research. However, in the 1960s, psychedelics became associated with the hippie movement. And they were then deemed illegal by the Canadian government, and that basically stopped all research on psychedelic-assisted therapy, and Canada was no longer able to do the research that they had been doing. Again, this sort of picked back up recently, where Canada has been legalizing ketamine for medicinal purposes, and so they've been able to use that to sort of enhance psychedelic-assisted therapy in the Canadian context. Now, here's where it gets a little confusing. So if you want to go to, say, this Field Trip place in Toronto, it costs $4,700 and you get 20 hours of service. That includes the before psychiatric consultations, during, and then afterwards, the 3 stages that I did describe to you. And again, they're using microdosing of ketamine. However, there are many places that do what's called ketamine infusions. This is not psychedelic-assisted therapy. This is solely the infusion of ketamine through intravenous injection. You sit there, you do the injection, and you go home, and it is meant to help with chronic pain, and they also use it in the case of depression. Again, this isn't exactly psychedelic-assisted therapy, but it is the delivery of psychedelic drugs for the purposes of therapeutic intervention for depression. Regardless of this, both of these processes are privately funded. The Ontario government, through OHIP, does cover 6 ketamine infusion sessions if you have a referral from your doctor and you go through the clinics that they deem acceptable. But again, this isn't really psychedelic-assisted therapy because they're not actually doing any therapy. They're just giving you the ketamine. If you're going to the place in Toronto that I mentioned, Field Trip, this is completely privately funded. You don't need a referral letter. You just go, you pay your money, and that's that. So I hope you've enjoyed learning a bit more about psychedelic-assisted therapy. I'm going to leave some organizations here that give just a more in-depth knowledge and more studies on the type of therapy if you're interested. It is important to note that while this type of therapy isn't really new, it is new in terms of coming to light in mainstream media and sort of mainstream psychology. So there's a lot more research to be done. There's a lot more studies to be done to continue to prove the efficacy and usefulness of psychedelic-assisted therapy for a multitude of mental illnesses.